This is a video for anybody who's been told that there is no other answer and all you have to do for the rest of your life is take medication for your chronic pain or illness. There is another answer and all you have to do is breathe. It's called thinAir.
thinAir is the most advanced adaptive oxygen therapy machine that promotes cellular health to recover, repair and regenerate. In the body, each cell needs to have an optimal levels of oxygen to perform its jobs. So if you have too much oxygen or not enough oxygen in the body will then start to not work properly, and this can cause disease and ill health in the body. So what we need to do is have optimum oxygen levels in our cell to promote good health.
We were commissioned by thinAir to redesign their adaptive oxygen therapy system. And over the last couple of years, we've been absolutely blown away by some of the stories that we've heard. Users have claimed that their chronic pain, their chronic illness has gone away, and all they've had to do is sit there and breathe. And I know from my own experiences and that of my family, just how much of a positive difference it can make to somebody's life. I have a personal connection to this because my own sister has used this product. For a period of years, her and her partner were unable to conceive. Just 3 weeks worth of using the machine, she was then able to conceive, and I'm now a proud uncle. Fast forward a year later and she did the same thing again. 3 weeks on this and now I have 2 beautiful nieces as a result.
Hello, my name's Yvonne and I've been using the thinAir machine for over a year now. I had some arthritis in my hand and I realised that the thinAir machine was very good for reducing inflammation, so I thought I would try it to get rid of the pain in my hand, and it actually worked. My husband had started using the thinAir machine. He was very sceptical about the machine. He's not a believer in anything like that. And the difference in him is quite staggering. I'm blown away by it. And it makes my life much better because he's better. He can now walk up a hill without stopping. He doesn't catch his breath. His sleep's better. Doesn't snore anymore, which is just amazing. As a family, we're going to carry on doing the top-ups because it reduces inflammation and it gives us a better quality of life as we age.
Hi, my name's Sue Rolfe. I'm 76 years old and I have been retired for the last 16 years, spending a lot of time looking after my grandchildren. 2.5 years ago I was diagnosed with type 2 diabetes. It came out of the blue. It was a bit of a shock. I've always been very active, done aerobics, rid my horse, mucked him out, looked after him. So it was a big shock, really. As well with diabetes, I discovered that what was wrong with my feet was neuropathy. So my feet and my legs and my hands were all affected by this. It's a painful condition and it makes walking quite difficult at times. Several months ago, I discovered it was getting more and more difficult to walk, more and more painful to walk, especially with my left leg. Then thinAir came along. I discovered thinAir and I was able to start taking treatment with that, which has actually made an enormous difference. I was so pleased that that happened because I was just beginning to think about mobility scooters and how I was going to keep moving around if I couldn't walk. I'm starting to walk longer distances every day now. We can walk right round the lock behind my house. No, I don't think I'll need a mobility scooter at all in the foreseeable future. So that's quite an exciting thing to have happened. You know, if you're skeptical about this, the best thing you can do is try it, even if it's just for 15 sessions. And I wouldn't mind betting that actually you'll be quite surprised yourself. For me, it's changed my life, so yeah, thank you very much.
It's around 3 years ago, I started to get really bad pains in my stomach. I had some tests and indicated that there potentially was cancerous markers in my blood. Luckily, it wasn't cancer, but we found what we considered to be a large abscess. Because they were going to have to remove a section of my small bowel and my large bowel to deal with this, they're going to have to cut you from like there to there. I would effectively end up with 2 stoma bags. A friend of mine introduced me to Chris, who's the inventor of the thinAir machine. So he very kindly lent me a machine and I started my sessions. So over that period of time of me doing quite a lot of sessions now, there was quite a lot of things happening to me. The pain started to go away in my stomach. I got a letter saying, surprisingly, the abscess is not there. We don't need to perform surgery on you. And he said, whatever you're doing, continue to do it. And it's got to be the machine because I'm not taking any other drugs for it. I know it's thinAir that's made me better. I'm 55 this year and I feel really good. I feel really, really good, you know, and I've got bags of energy. I don't understand it. I mean, the NHS should be jumping all over this.
I started my 15-day trial with the machine, and the one thing that really stood out for me was, I think it was roughly about day 11 or day 12 of using it consistently. There was just a shift. There was just a visual and a physical shift in my performance and how I recovered. And even, like I say, not even the performances on the bike, but also the way I felt after the bike. I started realizing, well, this is better, this is functioning, from the functions of the machine to optimize your breathing patterns, to utilize the red blood cells within your system, to reduce inflammation. It's a little step that I have above some of my other competitors by using the machine, and yeah, it's been part of my training regime for many years now. It played a critical part in my performances for both the Tokyo and Paris Paralympic Games, where I won on both occasions, 2 gold medals. It's thanks to the thinAir machine that I can perform as an athlete to my optimal performances.
So we heard all these stories and it was so compelling, so amazing to hear the good work that the product was doing. And as designers, we're so passionate about the world we live in and the projects we get to work on. So we wanted to do something different. We wanted to do our own study that was original and authentic. It was going to be backed by medical professionals, it's impartial, and ultimately with the aim of getting medically backed data that we can share with the world. And the results are fantastic.